Okay, there's an interesting kind of debate over why people smoke, right? It turns out that the cognitive effects of nicotine, the influence of nicotine on memory, attention, judgment, decision-making, etc. These are mediated, obviously, by networks that are found in the central nervous system. And there are nicotinic cholinergic receptors that are located, in the cortex, in the thalamus, in the hippocampus, very critical for memory function, for example. In dopamine networks, they can, nicotine promotes the release of dopamine in the mesolimbic and the mesocortical networks, in the basal ganglia as well. But there are different effects between subjects who are, basically dependent on this drug already, so smokers, right, versus, people who have their first exposure, to nicotine and have never experienced it before. This is something we've been discussing in the context of other drugs too, like for example opiates and alcohol. There's a difference between acute, the very first time you're exposed to a drug, and sort of chronic exposure, the changes that result in your brain, right, that lead you to experience a very different set of responses with exposure to the drug after chronic use. So in smokers, they tend to report with nicotine, increased calmness, right, kind of an ease, right, relaxation, improved mood. They feel that they're improving attention, improving memory. Non-smokers, they tend to get more aroused. It's more like an upper tension. They feel dizziness, lightheadedness. A very common first response to the administration or exposure to nicotine is nausea, and it can even lead to vomiting, depending on the amount of drug you're exposed to. And a lot of these changes or responses that are reported by smokers, a good question is, are these simply due to withdrawal relief? Because it turns out that smokers who are denied access, right, to their cigarette rather rapidly, it's been shown within 12 hours, so it can happen like overnight, start to experience craving, irritability, impatience, anxiety, difficulty concentrating, and insomnia. And a lot of the studies that suggested early on that smoking was beneficial for improving memory or improving attention or improving concentration, they were actually, first of all, funded by the Tobacco Institute, right, which was an industry group for the manufacturers of cigarettes. But in addition, they would run their studies as follows. So they would take a group of smokers who were completely dependent on the substance, and they would deny them access to the cigarette, to a cigarette for maybe 12 to 24 hours, right? So they would arrive at the lab, for their testing session, completely in a state of withdrawal, craving access to a cigarette, etc., right? All these other effects. And then they would take another group of smokers, and they would allow them to smoke their cigarette before they, had both groups engage in performing, a memory task or an attention task or some other cognitive task. And lo and behold, they would discover that the smokers who were allowed to, relieve their withdrawal symptoms, right, with a cigarette, did better on all of these cognitive tasks than the smokers who were denied access to the cigarette, right? So this suggests, to some extent, that withdrawal relief, is probably a very large component of the improvements that are being reported in smokers, dependent smokers who are given access to the drug. However, in the non-smokers, they are more aroused. So if they're not nauseous, if they're more aroused and they can avoid the nausea, arousal improves aspects of cognition. So non-smokers who are given nicotine do better on some tasks than non-smokers who are not given nicotine. So a question I have for you just to consider is, do improvements like in arousal, right, do these actually contribute to the development of dependence and abuse? The idea that you, as a non-smoker, take nicotine and you feel a little more up, and you're remembering things better, and you can perform a little bit better, you can pay attention a little bit better. Is that something that leads people, to try the drug and continue, using it on a more regular basis?